Congratulations for taking ownership of your financial plan by tuning into the Federal Employee Financial Planning Podcast, hosted by Mason & Associates, financial advisors with over 3 decades of experience serving you. You will rest easy once your plan is done. You will see clearly just how you have won. Gone are the times where you'd hope and pray. It's gonna be a bright, sunshiny day.
Welcome to the Federal Employee Financial Planning Podcast. I'm John Mason, Certified Financial Planner and President at Mason & Associates. This is our 3rd episode on our Medicare series with Bryan Gay of Boomer Insurance Group. And we have Mike Mason, Certified Financial Planner and founder of Mason & Associates, co-founder along with his brother Kenneth Mason here today. So on this episode, you have myself, John Mason, you've got Mike Mason, and then Bryan Gay from Boomer Insurance Group. Fellas, how we doing?
Really good at this, and I'm excited about this episode, maybe changing 25 to 30 years of advice that we've been given. But if you don't stay up with the things that are changing, kind of like tax code and now Medicare and Medicare Advantage, then you'll get left behind. So I'm excited about this, and Bryan, it's great to meet you today and be part of this show.
And folks, if you've missed the last couple episodes, so this again is a 3-part mini-series on Medicare. We've talked a lot about Medicare in the history of the podcast. We have episodes called Aunt Irma. We have other episodes that talk about FEHB and the coordination with Medicare. But this is unique because Bryan Gay has real world 22 years of experience helping people acquire Medicare supplement plans and Medicare Advantage plans. And he's been a great resource for our clients. So if you've missed the last 2 episodes, you'll probably want to go back and listen to those. This episode, specifically TRICARE for Life and Medicare Advantage. So let me say that title again, TRICARE for Life and Medicare Advantage plans. This is going to be completely foreign. So Federal Employee Financial Planning Podcast. What do we know about federal employees? We know a lot of you are also retired military, and a lot of you have TRICARE or access to TRICARE. So if this doesn't apply to you, we ask that you hang with us throughout the episode, because these type of changes are not just changes that affect military. They're changes that seem to be reverberating throughout all government health insurance, throughout FEHB and what have you. So hang with us. It may not directly apply to you, but we think you're going to love the information. Speaking of the information and the education that we're providing, our goal at Mason & Associates, empower, educate, and motivate. We're doing that through this podcast, through our YouTube channel, as well as one-on-one financial plans with clients. That by far is our favorite. We do financial planning first, and we do content creation second. If you like what you hear, 5 stars, check out the YouTube channel, or connect with us on masonllc.net if you'd like us to either A, give you a second opinion or help you through your financial plan. So guys, let's dive right in. Bryan, on the first episode that we did with you, we specifically talked about the car and the bus. And if you could talk really quickly about Medicare supplement plans, and then we'll go ahead and also loop in TRICARE for Life and FEHB, along with Medicare supplement plans. What are those? And then what's Medicare Advantage? And what the heck is this car and the bus analogy?
Okay, so I would highly recommend going back and listening to the other podcast about the details of the car and the bus. But the quick Cliff Notes or the Reader's Digest version, for those of us old enough to remember Reader's Digest, the short version is there's only 2 options in the public sector when it comes to choosing how you receive your Medicare benefits. You're either going to go with option 1 or option 2. Option number 1's been around a little longer, and it's with Medicare as your primary, with a Medicare supplement, which is also known as Medigap, and a standalone prescription drug plan. So with option number 1, you wind up with these 3 ID cards. You have your Medicare card, a supplement card, and a drug plan ID card. Now, I refer to that a lot of times as the car because it's usually more expensive for people to go that option, but it's a luxury. You can go to whatever doctors, whatever hospitals, whatever specialists. You can get top tier coverage and medical advice, but it's more expensive for people to typically go that way for option number one. So that's like the call, right? Now, on the other side of the coin is people who like the idea of trying to save as much money as possible. Well, you got to give up the game. So what ends up happening is this other program is called Medicare Advantage. Medicare Advantage does exactly what it is supposed to do, which is saves money. So not 100% of the time, but the large majority of the time, people who choose to go on Medicare Advantage save money over their retirement. But it's not designed for freedom and flexibility. Medicare Advantage is kind of more like the bus, where you have to go where the bus goes. So like a network of doctors. And with an Advantage plan, you pay these little co-payments when you go to the specialist or you go to the hospital or you go to have surgeries. So the normal, everyday public person without TRICARE for life, without federal employees' health plans, that's their two options. They're paying for the car where they can go wherever they want to go, and they have very little out of pocket when they do go, but they're paying more per month. Or they'll go with Medicare Advantage, like the bus, and they'll pay as they use it. So that's kind of the whole, short version of the car and the bus.
Thank you. And I think it's just such a great analogy, and it really just simplifies it down to both are applicable and both can be a resource for folks. And we kind of gravitate towards Plan G, or Medicare supplement plans for our private sector clients, but we can't turn a blind eye either to the fact that Advantage plans, for no pun intended, have a lot of advantages to them, one being cost. So do you value choice? Do you value cost savings? Are you okay with a network of doctors? Do you want more choices? Everything that we do at Mason & Associates is highly customized and individual for each client financial plan. But it's a good reminder, Mike, that we can't just go with the same old advice all the time, because Advantage plans are compelling.
Yeah, you have to get out of your comfort zone, which is hard for clients to do, and it's even harder. It's just as hard for us to do as their advisors, because health insurance it is scary. And folks, they do all their homework early, and they've been with Blue Cross Blue Shield, let's say, for the last 40 years, and they've never researched it again. They just know it always works, so they get afraid. Well, and to do that work again and try something different.
Well, Mike, we've said this for the 13. I always say four. We've been doing this for 13 years that I've been here. And our default, not that we give bad advice around health insurance, because I don't think we do, but the default for 13 years has been federal employee health benefits and TRICARE are pretty awesome. Basic is pretty good. Nobody's ever complained about it. Nobody's ever had an issue with it. Maybe you're on some prescription drugs that I don't know about, but seems like you might as well try basic, and if you don't like it, switch back to the other one, right? And that's kind of been, I don't want to downplay the advice that we're giving, but understanding formularies and understanding the different who fits into what insurance box is not something that we've ever really been really that great at or emphasized that hard.
Yeah, and then some of the times we do, I get to tell the old stories where I wanted my dad to switch from Blue Cross Blue Shield standard to basic. It was going to save them $200 a month. Plus, they would get that $800 per person rebate, for being on basic. And he was so comfortable for 50 years with Blue Cross, he didn't want to do it. And by accident, we got them on basic. We had signed up for basic during the open season. Bryan, he got frustrated with me, so I got back on during open season, switched it back to standard, and then 3 months into the new year, he called me. He says, "Mike, they're just charging me for the basic," and I said, "Well, Dad, I've got proof." He says, "Well, it seems to be working." So he says, "All I've got is 8 more months to go, and if I don't like it, I'll change it." So, that set off. Now 10 years later, Dad's not here, but Mom's still on basic. So,
well, and that's why, Mike, we're so glad to have Bryan with us too, because it seems like our financial planning practice is going to have to continue to morph and evolve like it always does. What we said on the last episode is our clients can rest easy because we're not. And it seems like health insurance is going to have to continue to be a bigger part of the conversation that we're having with clients with the Medicare Part D changes, the FEHB Part D plans that are coming out, FEHB Advantage and supplement plans that are coming out. Health insurance is going to be a bigger and bigger part of our practice. And Bryan, I just want to say thank you for being able to be there to help us through this transition, because it's not going to be easy.
No, and it's complicated because it's per person, per family. I mean, different people have different needs, so everything's customizable.
So we've talked now about the car and the bus. We've defined Advantage. We've defined supplement plans. I'd like to spend just a second discussing TRICARE and TRICARE for Life and what that means. So TRICARE is your military health insurance that you had while you were active military and into retirement. And TRICARE is TRICARE, and TRICARE is awesome. But there's a big thing that changes at 65, Bryan, and as we were prepping for this, you used a term that I thought was very interesting, and it's the payer of last resort. So at 65, TRICARE becomes the payer of last resort, and our clients are forced to enroll in Medicare Part A and B, and TRICARE changes, and it goes from being TRICARE to TRICARE for Life at 65. So a good way, I think, for our audience to think about it is the reason for the name change is essentially a forced enrollment in another insurance so that TRICARE becomes the backup or the payer of last resort.
Yeah, and to get that TRICARE for Life card, you turn 65, your TRICARE for Life card is your age 65 military ID, and then you can't get your age 65 military ID until you have your Medicare Part B card. So they go hand in hand.
Thank you, Mike. That's awesome. Bryan, the Medicare supplement route versus the Medicare Advantage route. What's the experience like for a client in that? So like when I think about my Part G supplement plan and I think about my Part D drug plan, when I'm going to see these doctors, I don't have any like out-of-pocket expense to see my doctor. I don't have any out-of-pocket expense for surgeries and things of that nature, but I am paying, if I have Part D, costs for my drug plans. Compare and contrast the difference one more time for our audience, because then we're going to launch right into TRICARE and Advantage. What's the Advantage experience like for most of America? What are they paying for?
Well, yeah, like you were mentioning, the difference between supplements and Advantage plans. With that supplement, you can go anywhere, do anything, and you have very little out-of-pocket costs giving money to doctors and hospitals. You pay a little bit more per month, but when you start using it, it's wonderful coverage with supplement, like Plan G, for instance. Well, now normal public people who don't have access to TRICARE for Life, who don't have federal employees plans, for some of these people, they're going to choose Medicare Advantage. So remember the analogy of the bus. Well, with Medicare Advantage, if you only have regular Medicare Advantage, then you have to go to the doctors that are covered by your Advantage plan. It's called a network of doctors. It's not a bad thing. A lot of people's group insurances these days make people go to certain doctors. Well, so with these Advantage plans, you'd have to go to, for instance, the United Healthcare Advantage Plan network of doctors or the Humana Advantage Plan network of doctors. And it's so funny because we hear people all the time going, well, I don't want to go to some cut rate, terrible doctor. And I'm like, oh, yeah, I wouldn't either. Who's your family doctor? And they go, well, Dr. Sidlecki. Like, well, dang, you better want to recheck that physician because Dr. Sidlecki takes most of these Advantage plans. Who's your specialist? Oh, well, I go to Dr. Reagan. She's the best dermatologist in the state. I'm never going to give up Dr. Reagan. I'm like, whoa, better check on Dr. Reagan because she takes a lot of these Advantage plans. So it's so funny to hear people who have preconceived notion with Advantage plans because they do make you go to certain doctors, but you'd be surprised on the quality and the quantity of the doctors that are covered by most of these Advantage plans these days. So it's not like you got to go 50 miles to the nearest person who takes your insurance and they've got a 6-month wait. It's just not that way. It kind of used to be a long time ago, but it's not that way anymore. But then, John, the other issue is the co-pays. So Without TRICARE, without federal employees, without anything else, an Advantage plan, you have these little or nuisance, really. It's like a nuisance copayment. Like you go to the specialist on your Advantage. Well, you might have to pay a $35 copayment, which I don't think is bad. You pay $35 for the specialist and your insurance company pays the rest. Your Advantage plan pays the rest. The other day we had a customer call and he was so beside himself. He's like, this is ridiculous. I went to the emergency room. He cut his hand, by the way, using hedge trimmers and literally almost cut his finger off. So he had a little small surgery in the emergency room, but he's complaining because his copayment was $100. And he's like, what? Why do I even have insurance? I had to pay $100 at the emergency room. And I'm like, $100? Your insurance company paid the rest, because he's always saying, what did my insurance pay? The rest. Chuck, they paid the rest. That bill was probably $25,000, and he paid $100 copayment because that's his copayment on an Advantage plan. So now, my wife, who's not politically correct, so I got to preface that, but she says the Medicare Advantage copayments are kind of like paper cuts. They're not going to kill you; they're just annoying. So the people who are on Advantage plans, they pay a lot less per month, and a lot of reasons, in a lot of ways, they pay nothing per month for an Advantage plan. And then they go to the certain doctors and they pay these copays. But everything changes when you have TRICARE, which I'm sure we'll talk about that.
Yeah, I think we should dive right in. Historically, Mike, the advice has been at 65 enroll in Medicare A and B. Your TRICARE for Life is free. Your Medicare premiums are $164.90 per month in year 2023 and will change going forward. And your out-of-pockets when you go to see the doctor are going to be goose eggs. Like, you're not going to have cost for healthcare in your retirement. And we've long said that this is the best coverage that somebody can have in retirement, but that may be changing.
Yeah, I'm very interested to hear Bryan tell us about how that's going to change, how it's already changed today and what he sees in the future.
So Bryan, as we've talked about on prior episodes, Advantage plans can be, we've just highlighted the good, the bad, the not so good, the not so bad parts of Advantage. But what always sticks out in my mind is this like irrevocable decision to go on an Advantage plan and then be stuck there. And on the previous episode, we had talked about you go Advantage at 65 when you're middle-aged and bulletproof, and then at 75 you have some cancer diagnosis or what have you, and you want different coverage. Well, it's at 75. You're not going to pass medical underwriting likely, especially if you've had a life event, which means you're not going to be able to make that switch to a supplement plan. So that's one issue. It's like Advantage, you're stuck there. The other negative that you and I have discussed previously is that if you switch off an Advantage plan mid-year and you were fortunate enough to get through medical underwriting, you still may have a gap in prescription drug coverage for 3 months or 6 months, the balance of that calendar year. So one, it's like super difficult to get off Advantage in the first place. And then two, when you're getting off Advantage and back onto traditional Medicare, if you're fortunate enough to do that, you're going to have a gap in drug cost or drug insurance. So how does it work with our military members? And your analogy about the Ferrari is really great, and the rule changes that happened, I think you said 3 or 4 years ago. Share with our audience the differences and how all this works with TRICARE.
Well, so I'll also preface this by I'm the exact same as Mike. I mean, for years and years and years and years, I mean, we're talking the betterment of 14, 15 years, 16 years. I was telling anybody and everybody who's on TRICARE for Life or about, they're approaching TRICARE for Life. I would say the same thing every time. First off, thank you for your service. And next thing, don't touch anything except get Medicare A and B. You're perfect the way you are. When you have TRICARE for Life, all you need is your Medicare Part A, Part B, and show that new military ID card that you're going to need to get. And don't buy any more insurance, and don't talk to anybody who sells insurance, because they're just going to try to sell you something you don't need it. I mean, that was my spiel forever. You're perfect. Leave it alone. Right? So things change, advice changes because rules change. But you also have to keep in mind, I didn't tell you this, John, that so I was raised in a military family. So I was raised by my grandparents. My grandfather was a 23 veteran of the Navy. So for those of the veterans, but that's either for me or against me sometimes with the Army versus Navy stuff. But all of my healthcare growing up was military because they were on TRICARE for life. And little people don't really, little known is when you're adopted like that, like we were, we actually got TRICARE for life. So I personally grew up with TRICARE for life. And these little stitches in the top of my head are from TRICARE for life paying for them. So I'm overly familiar with TRICARE for life. And that's another reason why I told people all you need is Medicare A and B and TRICARE for life, and you're perfect. Because that's literally like owning a Ferrari. It's the greatest healthcare you can get. Now, when I was still talking to my friends back in Oklahoma, we always thought Cadillac was the best thing ever. So it's like, TRICARE for life having like a Cadillac, because that was the top of the top. But with the way things change, see, here's what happened. TRICARE for life only worked with something called original Medicare. And original Medicare is Part A and Part B. It's the little flimsy red, white, blue paper Medicare card. And for years and years and years, as long as Medicare was primary, Medicare A and B was primary, your TRICARE for life picked up all the co-payments, all the deductibles. And that's why people on TRICARE for life, they'd walk into any doctor, they'd throw the Medicare card on the table, there's military ID on the table, and they didn't have to pay for any doctors, any surgeries, any ambulance rides. They were just covered. Well, then came Medicare Advantage plans in 2006. And people don't understand what happened with TRICARE for life and Advantage plans. See, when people go on Medicare Advantage plans, the Advantage plan company that you choose takes over for Medicare. So now Medicare A and B is no longer primary. Your Advantage plan becomes primary. And for years and years and years, TRICARE for life would not coordinate benefits with an Advantage plan. So it was a disaster for people on TRICARE for life to go onto an Advantage plan, because now the TRICARE for life people who've never paid a copayment at a doctor, they've never paid a copayment at a specialist or an emergency room, now these TRICARE for life people are paying these copays. They're paying $100 here, $30 there. So we used to tell all of our TRICARE people, don't do Advantage plans. Well, things change. And about 3 or 4 years ago, TRICARE for life started coordinating benefits with Advantage plans. So remember, John, I was telling you about all those copays that people have generally with Advantage plans?
Absolutely.
The paper cuts that are kind of annoying, those copayments. Well, if you have TRICARE for life, you don't pay those annoying copayments. So you can have an Advantage plan, which, keep in mind, most Advantage plans in America do not cost the consumer anything because they're federally funded. They're paid for by the government. So you can get an Advantage plan in most areas and pay nothing for an Advantage plan, have TRICARE for life as your backup to your Advantage plan. And then when you go to the doctors, you give them your Advantage plan ID card and your supplement ID, and your Advantage plan ID card, Advantage and TRICARE for life. And you still don't pay copayments for emergency rooms or doctors or things like that.
So before, you had mentioned that having the if you had enrolled in Medicare Advantage and you had TRICARE for life before, like 4 years ago, it was like having a Ferrari parked in your garage with like a Datsun with 400,000 miles parked behind it that couldn't move. It was like
That's
you have
exactly right.
this great vehicle that you can't drive because you have this barrier, and that barrier has now since been eliminated because we have this coordination of benefits. So if I'm hearing you right, under both scenarios, traditional Medicare or Medicare Advantage, I'm paying the exact same premium, $164 a month. It's either going to Medicare Part B or it's going to my Advantage plan. Right? So
basically, yeah, you're paying it to the same person every time. The $164.90 that you're paying is going to Medicare, and then Medicare has something to do with that money. They're either paying your medical bills if Medicare's primary, but if you go on an Advantage plan, Medicare doesn't pay your medical bills anymore. They take your money, of course, they take the $164, but then the Medicare pays the Advantage plan company a fair amount of money every month. But now you don't have to pay for the Advantage plan in most areas because the federal government's giving the money to that Advantage plan company. And now that Advantage plan company has to take the money from Medicare and pay for your bills at the hospital, bills for prescriptions and things like that.
So why, as a retired military person, if I'm paying the same rate for both, either traditional Medicare or Medicare Advantage, and under traditional Medicare, I have unlimited options of where I can go, and under Medicare Advantage, I have maybe more restrictions, albeit still great doctors like you mentioned earlier, why would I consider an Advantage plan over traditional Medicare if I'm paying $0 for both sets, and it seems like I'm getting better coverage under option one anyhow?
Right, because you're thinking of it like, well, I have original Medicare.
If it ain't broke, don't fix it.
TRICARE is picking up the balance. Well, so let's talk about these Advantage plans a little bit more. So if anybody's seen the rather annoying Joe Namath and Jimmy Walker commercials, they're always talking about Medicare Advantage, which is also known as Part C, letter C like Charlie, but Part C is Medicare Advantage. Well, these Advantage plans come with a lot of bells and whistles. So let's talk about some bells and whistles real quick. First off, there's vision. So I'm going to go from kind of least to most. So vision is something that TRICARE kind of lacks out a little bit on. But on top of that, with the vision of these Advantage plans, most of the time they'll give you $300-400 towards glasses. So that's pretty nice. They also pay for the eye exam, which is also kind of nice. So you get a little money towards vision and eyeglasses and contacts. But then on top of that, you also get money towards over-the-counter items. Okay, so like bandages, toothbrushes, vitamins, ibuprofen, Zyrtec, all these like ACE bandages. You get all this extra money from these Advantage plan companies where you can just get these over-the-counter items at no cost. So then those come for free. So that's a cost savers there. But then there's some of these Advantage plans that if you have certain medical conditions, they'll even give you money towards food. I mean, the TV commercials are about half right most of the time. Well, so for instance, there's quite a few Advantage plans around Virginia that if you have any type of heart problem, any type of diabetes, any type of lung disorders, or you're a little heavy, well, then you meet certain medical requirements, and these Advantage plans will give you $50 a month towards your groceries, or $100. I mean, there's some areas where they're giving you $200 per person per month for groceries. Well, most people buy groceries. So if you're on an Advantage plan and you and your spouse are getting $200 a month towards groceries, that's an extra $400 a month, which in Oklahoma, where I grew up, it's about $5,000 a year that you don't have to spend on groceries because you're getting it from your Advantage plan company. They're just giving you a debit card that you use at the grocery store. That's a pretty sweet deal.
It seems kind of odd that you're overweight and they're giving you money for food.
For food, well, because they're hoping that you actually buy carrots and apples instead of Apple Jacks and whatever else. But yeah, and actually, Mike, that's a good point because you're only allowed to buy certain foods with those that money. They don't allow you to buy like beer and cigarettes and things like that. So there is a little bit of limitations on what you can purchase on those things. But now on top of that, which is a big deal for a lot of our veterans, is dental. Now, keep in mind, you can always buy extra dental insurance, which costs you $30, $40, $50 a month, or the Advantage plan that doesn't cost you anything per month in most areas. Cost anything. Well, they'll give you $2,000, $3,000 towards dental. Now, if you guys remember regular dental through like regular employers, where if I had to have a root canal, I pay 50% of the root canal and my insurance company pays 50% of the root canal. I mean, that's pretty typical, right?
Yes.
Not on these Advantage plans. Because most of these Advantage plans, it's like having a gift certificate to the dentist. Now you got to go to the in-network dentist, so you just can't go to any dentist. But like, for instance, my dentist actually takes a lot of these Advantage plans. I'm not on Medicare yet, but if I was on Medicare, if I was on an Advantage plan, there's some of these Advantage plans here in the Richmond, Virginia area where I could go get a crown and a root canal and not pay a single penny because I have $3,000 worth of dental coverage. So now after I use up my first $3,000, then I'm on my own the rest of the year. I got to pay for my own dental. But that's not a little bit of money either. I mean, you got $3,000 towards dental. You get money towards food, towards groceries. You have money towards over-the-counter items. You get money towards, vision and eyeglasses. So there's a lot of little extra bells and whistles that come along with these Advantage plans that the TRICARE for Life people can get on. And then at some point, if they don't like the Advantage plans, they can, a TRICARE for Life person, this only works if you have TRICARE for Life, by the way. I can't say that enough times. It's only working with TRICARE for Life people. But in the middle of the year, if you do not like your Advantage plan, you can completely cancel your Advantage plan. And it pops you right back over to original Medicare as primary, TRICARE for Life as your secondary, and TRICARE for Life still covers your prescription drugs.
So it seems like to me the only time you're not going to be happy with your Advantage plan is when your health takes, a really severe turn, and you may need some specialists that you're not going to have access to on Advantage.
That would be the only reason. That's right, Mike. I mean, the only reason why you would not like to have an Advantage plan and TRICARE for Life is if you just needed to go to Johns Hopkins or MD Anderson or, somewhere like the Cleveland Clinic, But still, you cancel your Advantage plan. And that takes effect the first day of next month. So if you didn't like your Advantage plan in July and you canceled it in July, August 1st, you're back to where you were and you're heading over to the Cleveland Clinic.
It's truly amazing. When you start thinking about this, like it's effective the following month. And remember, you said earlier, Bryan, I want to make this distinction because it's very important that TRICARE is the payer of last resort, TRICARE for Life. And as we were practicing and getting ready for this call, I'd ask you the question is, well, if I'm still on a Medicare Advantage plan and I go out of network to receive care, what happens? And the answer was, if the Medicare Advantage plan didn't pay, TRICARE for Life's not paying. So it's very important to know that, like, if you're in the middle of switching between Advantage and Advantage and traditional Medicare, that you have to wait for that switch to take effect if you want TRICARE to pay for that out-of-network doctor.
Exactly right. Yeah, you want to wait to go, to whatever doctor you'd like to go to for the first of the next month kind of thing. Because otherwise you have to stay in the network of Advantage plan doctor. Now, keep in mind, there are some Advantage plans that give you out-of-network benefits, but you got to weigh those odds. Like some of those Advantage plans that do allow you to go out-of-network, maybe they have less dental, less vision, less money towards groceries. So then you kind of pick and choose which Advantage plan would work best for that particular person who goes to that specific group of doctors, that kind of thing. So it's always client specific.
So thank you, Bryan. Mike, I have a quick question for you. I know you've heard this gripe for a long time. I don't know when it changed, when retired military folks were forced to enroll in Medicare, but what is the most common complaint that we hear from retired military about healthcare?
Oh, yeah. They promised me healthcare for free for the rest of my life, but now I have to pay for Medicare Part B, so it's not free.
And what I'm hearing now is because the government is giving all these private sector health insurance companies $1,000 or $2,000 a month, whatever it is, to be on an Advantage plan. Bryan just said $3,000 a year in dental, $4,800 in food, vision, drugs, gym memberships, and I don't know. I got to $10,000 pretty quick. In benefits from an Advantage plan. So if I'm paying just, let's call it $200 a month for Medicare, That's $2,400 a year that I'm paying. But Bryan just told me that I'm getting $10,000 a year in benefits. So it seems like what the government has done is they're paying you $8,400 a year to have free health insurance. Unless I'm missing something.
Well, I would,
and we actually are missing something, John, because I didn't even mention there's something called a Part B reduction. So some of these Advantage plans, again, in certain areas, they will actually give you money back towards your Part B premium. Again, I'm just going to go with Richmond, Virginia, because that's easy for me to name off the cuff. But there's a few Advantage plans here in the Richmond area that will pay the consumer $50 a month towards their Medicare Part B premium. And there's another one that gives $100 a month towards their Medicare Part B premium. So for the people who are really upset about having to pay the government $164 to pay for Medicare Part B, if they choose some of these Advantage plans, that already lowers that Part B premium from $164 down to only $64 because they're getting $100 from their Advantage plan to reduce their Part B premium.
So I'm going to make a couple of statements, and I want you guys to correct me if I'm wrong here. First is going to be a question. Let's say I'm the military retiree and I'm subject to an IRMA increase in my Medicare Part B premiums. So I'll make up a number. Instead of 165, I'm at 330. Is that the same thing if I'm on the Advantage? If it's Part B 330, then it's Advantage 330 as well?
It is, John. Now, there's a little bit of trickiness in there because what happens is the IRMA is for Part B, as in boy, and also for Part D, as in Delta. So there's same Irma, same old lady. She's not real nice. She's a, conspiracy theory, extortionist. That's what I call her. But what happens is with TRICARE for life, you have to have Part B. And if you have a higher income, you have to pay more for Part B. Well, you pay more for Part B, whether you're regular Medicare or on a Medicare Advantage plan. Either way you go, you always pay the base rate for Medicare plus your IRMA for Part B, as in Bravo. Now, your TRICARE for life is not really classified as a Part D drug plan. So they don't have to pay the IRMA for TRICARE for life because it's not classified as a Part D plan.
That's a great point. You don't have to pay the D as in David IRMA, just the B as in boy IRMA. So many of our clients are federal employees with federal employees health benefits, and we tell them or advise them during the open season, maybe you can save a little bit by switching from this plan to that plan. And then we always say, and if you don't like it, well, you can come back 12 months later and switch again, so you're not in it for life. But it sounds like to me this is for military retired with TRICARE for life, this is almost like a Social Security decision. It's monthly, right? If you decide this month I'm not turning on Social Security, well, you get to have that decision again next month and the next month and the next month. If I go Advantage and I go 3 months and I think it stinks, for no other reason, I just think it stinks, well, I can go back to traditional, right?
Yep.
Or if I test drive this thing, using your car analogy, I test drive this thing for 6-7 years and I've loved it, and then I have that extreme change to my health, well, I can still go back then, and all the money that I've pocketed and the extra benefits that I've received by being on Advantage.
That's right. Now, you can always get out, but you can't always get back in month to month. So if you would like an Advantage plan, then you need to sign up for an Advantage plan between October 15th through December the 7th, because that window of time is the Medicare annual enrollment period. So October 15th until Pearl Harbor Day, which I think is ridiculous that they ended the enrollment period on Pearl Harbor Day, but totally different subject. But during those 68-day windows of opportunity, you can get an Advantage plan. Now, when you sign up on an Advantage plan during the enrollment period, it wouldn't start until January 1st. So then that's when you're test driving that Advantage program. You can taste it for January, February, March. And if you like it, you keep it. And if you don't like it, it's basically cancel anytime and you go right back to regular Medicare with TRICARE for life as your secondary.
Unbelievable. These benefits and the advice that we can be able to give to clients. This podcast is going to change the lives of retired military folks throughout the country, and it's going to change the way that we deliver financial planning advice to our clients for the balance of this year leading up to the Medicare enrollment period this fall, Bryan. It's tremendous. It's a huge opportunity for folks, and we're running short on time here, so we need to transition into action items. But I had one final question for you on international coverage. Like we talked about on a previous episode, we have a lot of clients that travel, and I don't know if you can speak to this offhand, and I'm certainly not an expert. How does TRICARE pay if I'm in Europe and I need a medical procedure?
Not really well.
It doesn't pay well, or you're not too familiar?
From what I've seen, it doesn't pay very well overseas. Like, I would always recommend getting traveler's insurance. Again, a legal policy goes a long ways.
Okay. And traditional
we don't
Medicare.
Even sell traveler's insurance, but that's a good thing to do.
And you mentioned on the last episode, traditional Medicare doesn't pay overseas either.
Not a dime.
But Advantage plans reimburse you?
Well, Advantage plans are supposed to reimburse you, but it's kind of a pain in the neck to try to get an Advantage plan to pay for an out-of-country bill, because they have all these stipulations where you got to get very detailed, itemized statements. And again, I've been doing this for a long, long time. I mean, we've got almost 10,000 10,000 Medicare clients. We've got like 9,300, I guess. But Switzerland, for instance, will absolutely not give you an itemized statement. And you'd be surprised how many people get hurt in Switzerland. So no matter what, just chalk that up to nobody's paying you unless you have traveler's insurance.
Got it. That's perfect. Well, guys, let's transition into a few action items. And before we go there, Bryan, our third episode with you, thank you for being a part of this Medicare mini-series. I think has been great, tremendous value for our clients and listeners throughout the country. So I didn't want to forget that. Thank you for being with us and being a part of the podcast.
Oh, you're very welcome. Thanks for having me.
All right, guys, let's go around the room here. Action items as we finish out this episode.
Well, it's kind of simple for me, and I'm going to take a lot of action items myself and look back through our book of business, military retirees, and have this conversation with them, no doubt.
Bryan, how about you?
I would say if they're open to learning about, their own circumstances and what's going on with, how it could benefit them, because it may be a good idea, might not be a good idea. So if somebody who's listening to this is a TRICARE for Life person, then just give you guys a phone call, give us a phone call, and we'll take a look at that scenario. And if it's right, then we can look at doing an enrollment during the enrollment period, and they can test it out for a month or a year or 10 years.
That's right. So Boomer Insurance Group out of Richmond, Virginia. This is Bryan Gay. Bryan, your phone number?
Is 804-464-8960.
There we go. So if you guys have Medicare questions, you can give Bryan a call. Our phone number at Mason & Associates, 757-223-9898. My final action item for today is, remember, a theme at Mason & Associates is educate, motivate, and empower. And we hope we're doing that through this education and through our meetings with clients. And we want to challenge you to basically challenge the status quo. The rules that you knew yesterday are no longer the rules that we're playing by today. Life is changing quick, fast, in a hurry. You can rest easy now because we're not, and we're Mason & Associates. We thank you. We're hopeful that you use this podcast and the information that we're producing to make some change in your financial plan. Although it can't be construed as investment or financial planning advice, we're hoping that you can use this education to be empowering and motivating for you and your financial plan. Thanks for being with us on the Federal Employee Financial Planning Podcast for Mason & Associates, masonllc.net.
You will rest easy once your plan is done. You will see clearly just how you
topics discussed on this podcast represent our best understanding of federal benefits and are for informational and educational purposes only and should not be construed as investment, financial planning, or other professional advice. We encourage you to consult with the Office of Personnel Management and one or more professional advisors before taking any action based on the information presented.